Okay, so I will try and keep an eye if anyone else joins. So my name is Lois Brown. I work with Modality Partnership, and I've been working with the Mid Sussex practices for a couple of months now. So I've been working with them on their improvement plan and how we move things forward for the practices in Mid Sussex. So with me, I have, I'm going to sort of go around quickly introduce people, and then we're going to do a very brief update for July, and then give you opportunity to feedback on the plan, how you'd like some better patient information and how we can engage in the future. That's the kind of brief overview. So what I'm going to say is that I'll introduce everyone first, and I'll just go through some just some house rules. So I'm going to go on screen. So I've got Rachel Luca with me. So Rachel, if you're aware, Rachel is our partner and lead pharmacist for Modality Mid Sussex. I've got Dr. Neelam Salimi here, who's one of our partners in Mid Sussex. I've got Dr. Ellie Flatman, who's one of our partners in Mid Sussex, but on maternity leave and holding the baby, not here at the same time. I've also got Jeanette Cox, who's our practice manager, one of our practice managers, and Bill Graham, who's going to wave me on you, Bill. Bill is our community and development engagement person for works with Modality Partnership, who's going to work on us with this engagement and then engagement going forwards. So I'm just going to share screen. And Bill's going to keep an eye on the chat for me so I don't miss any messages and things like that. So I hope everyone can see that. Please shout if you can't. We can't shout yet, but you'll be able to speak in a minute, don't worry. So we've done some brief introductions. Obviously, this is a Zoom meeting. We are doing some face-to-face meetings next week. It's just a bit of housekeeping to say, if everyone can remember that we're all after the same goal. We all want to improve services for patients and for staff in Mid Sussex. And we're going to try and give everyone a chance to participate. We have the chat going, you can ask questions in the chat. We also will be able to, at various points, you'll be able to ask questions, and hopefully everyone has got on the bottom, they can raise their hand to ask a question in Zoom. If you're struggling with that, please put something in the chat and I'll be able to know to unmute you to answer any questions. We want to make this a really, really positive engagement. We want to make sure we're not, causing blame. All these guys are here to work hard for you in Mid Sussex and provide the best service we possibly can. I respect, I don't want a Jackie Weaver moment where I have to chuck anybody out of the Zoom. I'm sure we won't have that tonight. And if everyone can listen and be engaged respectfully as we move on. And the bit I put at the bottom about confidentiality matters is that obviously you're all patients, but if you're going to talk about something specific about yourself or somebody else that's to do with your medical care, I've no problem people raising your general issues, but we would like to take that and deal that with you offline, because it was very difficult for us to respond to that in a public forum because of patient confidentiality rules. We will absolutely follow it up, but please follow that up with us afterwards, rather than we don't want to be risk of breaking any patient confidentiality. So that's the sort of housekeeping over with. So I'm going to run through the July plan for patients, which is you're the first guys to see it tonight. It's going to get released on our website and social media and via text to patients tomorrow morning. And then we're going to move on, and we're going to give you opportunity. I'll come to you a second, Maggie. You can see you've got a hand up. To go through how we're going to collaborate tonight. So we're going to give you an opportunity to feedback on that plan. And we will have a screen up where when I will be able to type up any comments you've got. We'll capture anything that's in the chat. Then we wanted to ask you about what better information we could provide for patients about how the services we provide, how you can access us, and in different ways, how you can raise your concerns. And then lastly, we'll talk about how effective this has been. What other future patient engagement opportunities would you like? And moving forward. And Maggie, you've got your hand up, and now I've got to work out how to get back to my participants so I can unmute you. 2 seconds, Maggie. There you go. You should get a message to unmute, Maggie.
Hi, can you hear me?
Yes, I can.
I did just put something briefly in the chat, actually, that I found out about this meeting by accident, and I'm completely in the dark about any of this. I had no idea that there was any plan to merge or whatever. I don't even know what this is about. I live in Mid Sussex, and from the way you're talking at the moment, it sounds like I should know about this, and I know nothing.
Okay.
So
no problem. I can give some context, not a problem. So no problem. So essentially we back in March, April, we produced an open letter in response to feedback from patients in terms of the service that we were providing. From that, then we've been working with the patient participation group and other patients to form an improvement plan. We released in June, we released an update, which is on a similar style to the one you're going to get, but a different version of it, that talked about the challenges we were facing, the feedback we'd received, and what we were doing to try and respond to that.
Sorry to interrupt, but so how would I have got that?
So it went out on text, it went out in paper in practice, it's displayed in practice, and it's on our website.
But maybe I'm misunderstanding. Is this like a collaboration of all GPs in Mid Sussex?
No, it's just Modality Mid Sussex patients.
Oh, right. Well, I've never even heard of you.
Oh, yeah. Oh, you could join the fun. I'm going to turn my light on so I'm a bit dark. Okay.
Who is Modality? Because the way I found out about this was by complete accident, and it sounded like this was a group of practices in Mid Sussex,
which we are
together.
So we were a group of 4 practices that already work together. So if you're not a modality patient, it might not be that interesting for you.
Oh, fine. Okay, it wasn't very well explained where I found out about this, so I'm going to go. Thanks. Bye.
Lovely to meet you. Bye. Okay, thanks everyone. That's a first for me on a Zoom meeting. There you go. So I'm going to go through this July plan. So anyone who saw the June one, it was a similar look and feel, but obviously we've got different content. So there's 4 things we pulled out as sort of priorities for from the past 4 weeks, and we've been working on. So the first one, excuse me, is we identified that there's an issue in terms of the fair distribution of face-to-face appointments across our practice sites. Obviously, you all live in Mid Sussex, you're familiar with the geographics, and we know that poorly down patients are being disadvantaged by that disproportionately to the other practices. So we are working with our rotoring and our appointments, and in the next few weeks, we're trying to move that so that we make sure that it's fair for every practice site and every patient. So we're working on hard how we can improve that. We want to acknowledge that, and we're sorry for that, because we don't want anyone with disadvantages to have to travel further or not be able to access care because of appointments are available in the wrong location. So that's something we're working towards at the moment. We hope to be able to do something by the autumn to make sure and gradually make that fairer and fairer for everybody. Call wait times are always a big thing with GP practices in terms of how long patients have to wait on the phone before it's answered. So the team have been working really hard. We've had some good recruitment, and we've been able to reduce that time down to a better level, not a perfect level, but a better level. So we are working hard to get that down even further. We're doing some more recruitment, and we're working hard in how we monitor our calls across all our practice sites to make sure they're answered in a timely manner, as quickly as we possibly can, as efficiently we can. The other thing we're doing, which we'd hoped to have done by tonight, but we are changing the phone messaging on the system to make it more user friendly, to make it more informative for patients to understand what their wait might be, and the different ways they can access this, so they don't have to wait on the phone. So we are that's coming in the next couple of weeks. We're just working through that in terms with our phone provider about how we improve how we message and communicate with patients when they're waiting on the phone. Well, our website, we've updated our website in a first phase for the website. So we're looking to talk a bit about that tonight, about how we can improve that further for patients. So we've made some changes there. So I'm just going to omit some of We've made some changes to the website. They're not perfect, but we're getting there. We want to get some feedback from you tonight about how better we can communicate using the website, also understanding that not every patient has access to the internet or uses a website or finds that easy. So we want to produce some how-to guides that we can hand out in practice for patients to understand, say, how to access their test results or order their medication in different ways. So we're looking at how we can improve that. Also, we're working with some of the PPG, they're pulling together a list of community venues and groups that we could share information through. So we're looking at doing that as well, but hopefully we can get some input from you tonight on that. And then obviously the age-old thing is you ring at 8:30 in the morning, wait on the phone, and then when you get through, the frustration of that actually there aren't any appointments available for you. So we're working hard with the team to increase the number of patient appointments that we're offering for patients. So we're doing that through recruitment, we're doing that through working in different ways, employing different types of clinicians to channel demand to the right person first time. That doesn't always have to be a GP. We also want to communicate that if we are full as our capacity for that day, and you are communicated to by the team that actually anyone who's flagged as red flag symptoms or under 5, over 80s, palliative care, pregnant or severely mentally unwell, that still gets through to our GP team for assessment. And our team on the phones will escalate people's issues and symptoms to the GCTPs on that day. The other thing I should have mentioned, I forgot to mention the middle one about call waiting, is we've had a really good uptake in our patient online triage system. Again, I know it's on the website and that's not for everyone, but it's open at the moment between 9 and 12 for a limited number of medical queries to go through that you can access, send through a request to be assessed, and then also for any admin queries between 9 and 12 you can put through that way rather than having to wait on the phone. So they were sort of our frequently asked questions for this last month. The plan that we've been working towards, so we've in June we managed to secure some additional GP appointments, both remote and face-to-face. We've recruited some more receptionists who have started, and some, I know some more have actually even started today. We've been looking at improving the service we provide in terms of making it easier for patients to cancel appointments. We've got a form on our website. We're looking at a way potentially we could do that through our phone system with a certain option that people could record a voicemail to be able to cancel their appointment rather than having to wait on the phone. So we're looking at different ways to do that. We want to expand, we expanded the patient triage in June, so it's open 9 till 12, and we're obviously in the future would like to expand that further because a lot of patients have found that quite good. And then we'll talk about engagement. So the other things that we're working on is further recruitment. We've got a new paramedics practitioner starting, a new practice nurse. We've got some advanced nurse practitioners that are going to start working with us. We've got new salary GP starting in August, which isn't that far off. In terms of the things we're working on improving service, like I talked about the phone messaging, want to improve that. That our patient services team have had some really good care navigation training, and we're following that up with the team to create a resource for them, online resource, so they can signpost patients to the most appropriate services if it's not necessarily a GP practice service. We're looking at how we improve our call handling further, how we can reduce that weight on the phones. And hopefully in the autumn we are going to reintroduce group consultations, as well as we are launching an online health coach service, which has proved very popular in other areas of the country, where patients can sign up for lifestyle advice and have their own online coach through an app. Again, I know it's not for everybody, but it's it can be very useful for people who want to lifestyle and exercise goals to achieve. We are committed to producing this publication every month and updating this data for you, and showing a plan. We're engaging tonight. We'll be doing that again in 3 months' time, and we want to get your feedback about what that might look like and what you might want to sort of channel the thought process in through in those certain events, what the certain things we could look to improve, and ongoing development of the website I've already talked about. So how do we do in June? So I've already talked at the bottom, you'll see that the orange line is the call answering in across the day. in May, and the June, the green line is the reduction. You can see it's a reduction in how fast we're able to answer the phones, which is really positive. We know it's not absolutely perfect yet, but we're aiming for much quicker call answering, and the team are working really hard to do that. You can see how many appointments we provided, which is up from May. The reduction in face-to-face was, we think we did last month in June we did, or May, sorry, we did about 60-something% face-to-face. It's 54% this last month, because we have brought in extra GP resource, but some of that has been remote GPs, and that hence not as much face-to-face as we were offering the previous month. In terms of the percentage, is more appointments, but in terms of the percentage. Down the right hand side, I think it's pretty self-explanatory. You can see the different elements of work that we have to do behind the scenes to make sure everyone's cared for. Patient feedback. So we've started in the past couple of months. Beth and her team have been sending out monthly text messages and paper forms available in practice to ask people what they thought about the care that they received. We've had some good feedback, and we've got some feedback we can learn from. So we are actively collating that and looking at different ways we can collate that feedback from patients. And at the bottom, it just shows you how you can get in touch with us to share your thoughts about the service, and get in touch direct, especially like I was talking before, it's about something clinical that you've got a concern about. Please get in touch. Oh, I can see someone with their hands up. Is it Ray? I'm going to find you, Ray, and unmute you. 2 seconds. It should give you a message to unmute.
Yeah, can you see me, Lois?
Yes.
The yellow t-shirt. I'm sorry to interrupt your flow. Would you mind presenting your slides as a slideshow rather than the raw PowerPoint? It'll just about double the size of the text. Yeah, that's lovely. Thanks.
Is that better? Sorry, you should have shouted earlier, Ray. Thank you. Yeah, that's not a problem. I will share these afterwards with you, so I can email those out so everyone can have a proper look at them, if that would be helpful for everyone who's attended tonight. Yeah, great. Thanks. Yeah, so that's patient feedback and the different ways we're capturing that. This is the last one before I get asked for questions and feedback. Don't worry. So we're trying to keep this up to date every month. The first part of this is very similar to last month's, talking about how you can book an appointment, how you contact us online, how to order repeat prescriptions or prescription queries, how you can cancel appointment. I've also included this month, there's some information we put on the website about how to find out about your test result or investigation, because I know that is sometimes something we don't communicate very well, and also we're encouraging our clinicians to say this sort of information to patients when they're requesting tests for people, so they understand what the lead time is. What do they do if they haven't heard? What do they do if they're concerned? You know, when to be concerned, how long, and all of that. So that's something else. And this is this sort of knowledge that we're sharing on the website and in this form, and we want to do about this how-to guides from practices to share with patients to try and really and make sure everyone understands how it operates and when they should be concerned, when they shouldn't. So that's where we're at. So I've talked enough. So I've got feedback on the plan. So I think what I might do is see if I can stop the share, because otherwise I can't really see very well. So what I'm going to do is keep open in the background the feedback on the plan, and then I'm going to be able to type on a different screen in the different things. And what I'll do is I'll type any input that we've got, and then I'll share that after each section, as that's okay. And then anyone, if I've missed something, can shout at me and say you've missed, I said this. So I've talked through, I'm just going to admit somebody that's just arrived. I've talked through that plan pretty quickly. I haven't been monitoring the chat. Bill, where are you? Going to unmute Bill. Is there anything that's come out of the chat to start off with, Bill, that I should? Oh, Ellie's got a hand up as well.
I was going to say there was a good question which does come up, about why patients can't book appointments online. I mean,
you want me to answer? I've answered everything.
Ellie's answered it in the chat,
but I can answer it now again.
Yes,
if you want. But I've answered everything in the chat, but I can answer the one about online booking if you want, because it's useful. So we know that the online booking is really useful for patients. internal challenges about how that's managed in the practice, because at the moment there's no way of differentiating the type of appointment. So for example, if you wanted to book a blood test appointment, you might accidentally book into an appointment that was meant for a smear test or something like that. So the logistics of booking into the right slot type with the right person that's for nursing appointments. And for doctors' appointments, because we're using the triage-based system, which I'm sure lots of you have now had experience of, with questions being asked to direct you to the right place. If you can book in directly, those triage questions can't necessarily be answered. So it's getting patients into the right place. So, but we are looking at it because we know that patients do find the online booking convenient, and we know that some practices had a lot more of that prior to the merger than others. So we are looking at that. Hopefully that answers that.
Yeah, thanks, Ellie. Okay. Would anyone else like to ask any questions? This is on the plan. So I'm going to set a time of about 10 minutes on this. So iPad 4, let me find you. I should get a message to unmute. Is that okay? Has that worked? Go ahead and ask your question. Hello? I've definitely unmuted you. iPad 4, we can't hear you.
Hi, no thanks. No, I put my hand down. Thank you very much.
Oh, okay, no problem. Okay, anyone else with a question on the plan? Oh, I've got going to go to Ray first and then Jane.
Thanks. It's not a question, it's an observation that the window of opportunity for making an appointment 8:30 in the morning and then not after that is a little bit narrow, and it would be nice if you could phone at any time and be considered for an appointment.
Okay, that's a good question. I'm going to come to Neelam. Do you want to answer that? About that, I'm trying to find you on the list. It's a long list. Oh, there you are. Found you.
So regarding the booking of appointments in the morning, we do have a triage service in the morning where if you are acutely unwell, you are able to get yourself onto the duty doctor list, and as a result you'll have a call back from the duty doctors. Every day we do open up appointments, routine appointments, for routine pre-bookable appointments, sort of 3 weeks in advance, and they are open throughout the day. We're still working on increasing our capacity so that we have more availability to sort of book further on in the day.
Yeah, I think that's a really good point. I think Ray, I think we've got to be really honest. We'd like to be able to offer a lot more appointments than we currently are offering. So I think we're working really hard in terms of looking at international recruitment. We're looking at different ways we can operate in terms of maximising our GP capacity for patients. Because at the moment we appreciate it's really, really difficult to get an appointment after set times. And especially when you've got an ongoing health concern and you want to follow that up as you would with a GP, that's where we're struggling to provide that capacity. And also we understand the frustration that within a very short space of time in the morning, we're saying that message about we haven't got any appointments available today, either call back tomorrow. We are looking at the extended access appointments. They're often in different locations and how we can better utilise them. But our main aim is to try and increase as quickly as possible that capacity of appointments for patients. Does that help answer your question? Oh, sorry, I have to get you unmute again. You were too quick to mute, Ray.
Okay, I'm unmuting myself here. I think I heard someone say that you can phone anytime during the day and possibly get an appointment in the future, because I think that's been a bit of a frustration in the past. Fortunately, I mean, I haven't had to phone for a doctor's appointment for a little while now, but I got the impression of late, you could either phone at 8:30 and get an appointment today, or you could phone at 8:30 tomorrow and get an appointment tomorrow. But I couldn't phone at 3 o'clock this afternoon and get a spare appointment sometime on Friday.
Yeah, I think that's a fair assumption at the moment. We are releasing a number of routine appointments every week, and I would like to increase that further, because we don't think we're adequately meeting that demand for that routine appointment, just like you're talking about. So that is an issue at the moment, and again, that all comes down to the number of appointments we've got available to offer, and that's why we're trying to look at more GP appointments, but also more advanced nurse practitioners who could deal with acute things on the day and frees up GPs to do some more routine, more complex follow-up. So that is something we're working very hard to try and achieve. I've got Jane iPad just asked to unmute on that. Does that work, Jane? You should get a message, Jane, to say unmute. Oh, got it. Or not. Can you hear me, Jane? Jane, do you want to put in the chat if you can't? I've given you the message to unmute, so I'm not sure why that's not working. And we'll see if we can do it. I'm just going to type availability of routine appointments and appointments in my little thing. Anyone else with a question on the plan?
Oh, yeah, sorry, that was my.
All right, don't worry.
Didn't want to let me. I'm just wondering whether you could explain what changed when Modality took over and why the service changed so dramatically. I know COVID sort of got in the way of, I'm not quite sure when Modality actually took over, because I'm not aware of being notified at all, either about a merger, possibly about the fact that it was going to be called Modality, but that's the only thing we might have been told. I'm not sure that we were even told that, but you know, why did things change so much? Because Judges Close seemed to be running perfectly well until, so what did Modality do to basically mess up the system of being able to phone, get an appointment and see a GP within maybe a week?
Okay, I think, Ellie, have you got your hands up to answer that? Let me
Yeah, I'm happy to try and answer that. Behind the scenes, I think there were significant problems in the two East Grinstead practices prior to us joining Modality. Lots of you have heard me say this before, but those of you that haven't, Modality didn't take us over. We joined Modality. The partners who work in the practices, you know, those of you who are from Ship Street know I've worked there for 10 years, and we joined Modality to help us through the challenges that we were having with losing doctors and access issues prior to joining Modality, to actually help us through that. And I know from a patient's point of view, they feel that the culmination of us joining Modality or merging the practices was what caused the problem, but actually behind the scenes the problem was already coming, and then COVID arrived, and then it culminated in the situation. And actually from our personal point of view, we've been able to access some help to keep the practices open, and actually one of the practices in East Grinstead would have closed if we hadn't have joined Modality, which would have meant that the patients would have been moved to the other. And I know that maybe the patients and things weren't so aware of that, and the challenges of COVID made it very difficult to communicate with people with regards to what was happening, and also the internal challenges with the practices really, and the pressure that we were under, especially at Ship Street prior to the merger. So I know it appears that the joining of Modality actually created the problem, but it actually didn't. The problem was already coming, if that makes sense, and has culminated in other issues following on with the problems with general practices across the whole country, which I know, you know, are well publicised. So hopefully that slightly answers that question.
Thanks, Ellie. Okay, I've got Jeffrey. Have you got the message, Jeffrey, to unmute? Jeffrey Staines.
Hello.
Hi.
Hello, it's actually Shirley.
I know, you've thrown me there.
Yeah, can I just ask, earlier in the year when I needed an appointment and there were no appointments, and it was and no appointments anytime soon, it was suggested I contacted or made an appointment with Push Doctor. I think I've got the right.
Yes.
Who I spoke to via video later in the day, and got excellent advice, excellent treatment. And I thought, well, that's a solution to a problem. And a few months later, there were no appointments when I needed some advice. And I said, could I have a Push Doctor appointment, and was told that that was no longer available. And that struck me as of solving a problem and then immediately unsolving it. So what happened to Push Doctor?
That's a good question. I'm wondering whether Ellie might want to know as well, if that's okay. I'm going to find Ellie in those 2 seconds. There we go.
Yeah. Sorry if my baby starts crying or making noises, sorry. So the Push Doctor had some challenges from an internal point of view, and we know that Push Doctor suited some patients, and certainly I've used the kind of Push Doctor type services with my own practice, and I think for some patients it works really well, for some patients it doesn't. But what we were starting to find when we were coming out of COVID was that actually what was happening to a lot of patients, obviously not in your personal situation, but actually what was happening, a lot of work was being redirected to the practice. So what was happening is that people were having a Push Doctor consultation, and then they were actually being asked to be seen in the practice, or we were being asked to organise test results and things like tests that maybe we wouldn't necessarily arrange ourselves. Which was creating quite a challenge for the doctors actually working in the practice, because it seemed to be creating a quite significant duplication of work. And I know not for everyone, but that was having quite a significant impact on the daily kind of workload for doctors, which was one of the reasons that we made the decision that actually Push Doctor was potentially increasing workload for us and for patients, because it's not hugely helpful, is it, if you see someone online and then they say, oh, actually you need to go to the GP. But so that's one of the reasons that it's kind of, we made the decision that we weren't going to run with that any longer.
Can I sort of dispute that, because actually being told that you need to see the GP is probably reassuring if, like me, you don't see GPs very often and you always hesitate to wonder whether you should bother them or not. So actually I found that quite reassuring, that and that strikes me that that sort of I know it was increasing the GP's workload, but actually it was looking after the patients more.
I think it's I was going to say, I think it's also worth mentioning that any funding that was used for Push Doctors now been put into face-to-face GPs in practice.
Yeah.
So that's where we've directed that funding into making sure we can provide more face-to-face GPs in practice with locums to backfill. Is that fair, Ellie?
Yeah.
Yeah, it unfortunately it doesn't happen. And the second time when I suggested Push Doctor, it resulted in no advice and no appointment, and which is a bit sad. I just thought that Push Doctor seemed a good solution in this interim period when you were trying to get things more organised.
Thank you, Sheila. But I put it on the list to highlight as an issue you raised, so we will.
Thank you.
Yeah, no problem. So I've got Coral's got her hand up.
Can you hear me?
Yes, yeah.
Okay. I was just wondering, so a number of times a while ago, when I used to call up, I would get, if the practice themselves at Ship Street couldn't see me or my family, I'd get referred into QVH, and just wondered, that doesn't seem to be an option anymore, and just wondered whether it is still an option or whether things have changed.
I'm going to default to somebody locally to answer that question because I thought it was still an option. Is it Neela, have you got your hand up? Yeah, there you go.
So QVH is the hub where there is appointments still available. So we have a set amount of appointments allocated to Modality Mid Sussex on a daily basis. And you are still able to access appointments at the hub to see a doctor, a GP at QVH. Again, there is capacity issues, I'm afraid, so it means that there is very limited appointments available on a daily basis. Jeanette, do you know how many we have? Or
Let me find Jeanette in the list. Yeah, okay.
Again, I think it differs each day, Neela, depending on what capacity they've got, because it's a shared resource within our PCN.
What sort of range are we talking about though? I mean, I'm speaking from, say, I would say a good 6 months ago, if not more. So I'm sure things are changing all the time. But all I know is at the time when I phoned up, those 6 months ago, you know, I was pretty early in the queue, as in like the first 5, and to be told there's no appointments in the practice, and there's no option with QVH, and there's no push doctor, I just wondered how many appointments there really are then. That's what I think makes patients worry.
So I think I can answer a bit on those, because those appointments are what we classed as enhanced or extended access outside of core GP hours. When I've been in practice in Mid Sussex, they are offering those appointments. I think we could be better at screening who is awarded those appointments, in terms of sometimes I think that they can be badly utilised when actually we've got a lot of people that generally need to speak to or see a GP, and sometimes they're filled with things that actually we could deal with in a different way. So I think, but there are quite, I've seen them on screen, there's a large number of telephone and face-to-face appointments in those enhanced access thing, but like Jeanette says, it will vary on the availability of enhanced access. Ellie, are you wanting to come in on that point? Is that what you've got your, yeah, okay.
Yeah, and it's also to do with funding streams as well. So the funding for the appointments that were provided at the Queen Vic has actually been rediverted to extended access appointments. So that funding is now no longer available. So some of you may have been to appointments at Moat that have been provided at Moatfield through extended access. And that some of that funding has been removed to there. So that's the reason why some of them are not available any longer, because actually we can't provide them because they're actually not funded anymore, and there's no one there to staff them, for example.
Okay, thanks, Ellie. Coral, do you want to come back? Sorry.
No, just thinking.
Okay. Judith. Should get a message if you got a message.
Yeah. It was just a positive to say I phoned today and I got an appointment at the Queen Vic. So it is what.
There are some appointments, it's not me.
Yeah, there are. I've got to go on Sunday morning very early, but they are there. So it is working. And I have to say the receptionist today was extremely helpful.
All right, brilliant. Thank you, Judith. Okay. I've got is it hang on a second, I just jumped around. Siobhan, is it Siobhan? I've just clicked on you.
Hi, can you hear me?
Yes.
Yeah, it's Siobhan. Yeah, I just want to come back on something that's happening on the chat at the moment. A couple of people have mentioned, and I'm also very, very worried about the state of the service as it is and the new developments that are happening around the area. I wonder what sort of like proactive approach we can do to kind of, I really fear for the residents of the East Grinstead area, because the situation is dire, obviously. Are you going to implement something to kind of, forecast for these hundreds and hundreds of new patients that are going to register with the surgeries in the area?
That's a really good point. I think I've got some of our commissioners on tonight, so I might default to them. But I was just going to say that at the moment, I don't know if you're aware or not, but both Moatfield and Modality Mid Sussex practices have capped lists and are managed by the local commissioners. So I think I did see Karen somewhere. Karen Salis, am I right to unmute you when you could answer that? Karen, you there?
Yep, hello, can you hear me?
Yes, we can hear you.
I was just trying to get my camera to come on, so I don't know if it has, but good evening. Yeah, so I mean, this is a challenge that we are facing right across the county with so much house building going on. And from our position, what we're trying to do is support practices where we can to prepare for that. So for example, we've got a couple of the modality sites have recently been improved and extended to provide additional clinical rooms. We're doing looking at something similar with Moatfield. So estate is one challenge with this, but the main challenge is workforce and attracting new doctors, nurses, receptionists, etc., to come in and fill any new estate to be able to see patients. So we are working, our workforce teams are working on schemes to try and attract GPs into the area. Modality themselves are working very hard and have, as they've mentioned, have gone out looking at international recruitment as well as advertising locally to bring people in, looking at sort of new ways of working to attract staff into the area to work and help look after. But I can't pretend that this isn't going to be a challenge with all the new housing coming in. So we are looking at that across the piece and working with the practices to try and prepare for that where we can.
Thanks, Karen. I think we talked to it recently in the PPG meeting, and I did say we should maybe, you know, have affordable housing more. Maybe we should have some housing for healthcare workers in these developments to attract people to the area to come and live and work, because it's a real issue. And I know, particularly as my time I've spent down in Mid Sussex, there's huge developments going on, issues with utilities, never mind as well as GP practices. So it's a real concern as how these people are going to be served in doing that. I think, have I got any more? Did you want to come back in, Siobhan, or there's an old hand? Is it? I've lost somebody in my list now. Hang on 2 seconds. I wanted to do something funny with my Potter pigeon. Frankie's got a hand up. I'll ask Frankie. Frankie?
Yeah, I'm here. I'm just working out how to do it. Hello and thank you. I'm a member of the patient participation group and been working with Lois and the team, and it's great to see how much work has been done, and it's clear how many concerns there still are, but it's great to see everybody, you know, wanting to hear what they are and still work on them. I wanted to come in on that last point, which Lois, you might think is a flippant one, but I think if Karen is still around, correct me if I'm wrong, Karen, but as commissioners, you can work with local authority planning departments and to get every developer has to promise so much money to the community to build primary schools, infrastructure, including GP surgeries. And it may well be possible for you to be able to persuade and work with local authorities to actually offer some of that housing to doctors as an incentive to come in, as well as to get GP services paid for, additional GPs and other healthcare professionals. So I just thought I'd put that on the table for you, Karen, because I do think we have to be as creative as possible in order to get more doctors into Mid Sussex.
You are absolutely right. So there is the Section 106 monies, which is the money that developers are required to contribute for things like healthcare and education and infrastructure. And we work very closely with the councils to make sure that we have bids in for the health services in the area. And I mean, this is the, so we have funds allocated, which is part of what we're looking to work with Moatfield in the area. We got funding through a different avenue for the work that's been done on the modality sites. But yes, we certainly are the first ones in there, I think, when any new housing developments are going through planning and are agreed, to make sure that that the Section 106 monies, we get a good proportion of that comes to health, because we have to put in a bid along with the other sort of infrastructure areas.
Thanks, Karen. So I've got Jane's iPad next with their hand up. I'm going to unmute them, and then I'll come to, is it Liz? Jane first. Jane, are you there?
Yeah, I think it seems to me that the main problem for most people is this 8:30 time point, you know,
yes,
which for a lot of people is just not a convenient time. You know, if the phone was going to be answered immediately, it would be maybe just about workable. But if you've got to hang on for half an hour or even 10 minutes, quarter of an hour, I mean, most people have got something they're trying to get to at that sort of time. So I really think that the main focus at the moment ought to be on staggering that somehow, so that it's not just a one thing. Appointments all mostly probably being taken by people who have actually turned up at the surgery before that. I think it's important that some appointments get staggered to other times in the day, so that different, you know, arrangements can, different people's commitments. I mean, for example, I work as a volunteer and I need to be in Crawley at 8:30.
Yeah.
So I'm travelling, and you know, it's just not, if people are busy and doing stuff, you know, it's just not fair to say you've just got to ring at 8:30.
Yeah.
Because maybe it's only, you know, not only weekends when you could do that easily.
Thank you. It's a good point. So as well as that, one of the things, and I know it's not for everyone, but in terms of the patient triage system that we're using to allow patients to send medical requests and admin requests through online. Now, this is something we'd like to expand going forward, to open in terms of increasing the capacity of it, but also the longer opening hours to make it easier for patients to use. It's something I can speak on behalf of things we've done elsewhere in the country, in Yorkshire, in Lewisham, and in Walsall. We've done quite a bit of work piloting systems where patients can ring up and still ring up and speak to our team, and they will put it through the online system for them, or they can do it themselves. Like 90% of our patients in Yorkshire are filling it out themselves. That lands straight with the duty team and it's assessed and done that way. That is something we'd look to want to put in the future for Mid Sussex as we build our workforce up, because we understand that actually, you know, like banking or anything in the world, there's different channels now, and those who can use online, it's much quicker and easier for them to do it that way, and those who can't, makes the phone queue a lot shorter for those who can't to get through is quicker, and we can access their query straight away. So it's a really good point, and that's something we were exploring along elsewhere, as well as looking how we can improve and build that capacity here, if that helps, hopefully. And then I've moved to Liz, and then I'm going to have to move on, but Liz, go on. It's not Liz, is it?
It's Bill. No, it's Bill. Bill Glenister. Just to comment on what Karen was saying, here in East Grinstead, a lot of developers have got round paying the 106 contribution by making sure they just, when they develop a site, they make sure there's just one house less than the amount required to pay 106 money. So I suspect there isn't much funding or enough funding there in the Section 106 kitty to pay for the amount of doctors and other medics that we need in the area. And then I've got a question, please. What sort of training goes on in the triage? Because surely if there's very limited availability of appointments and things, it's vital that the people conducting the triage are able to assess medically, you know, who is most important.
Absolutely, and I've unmuted Ellie ready to answer that question.
So triage there's two kind of elements of triage that happen. Please, obviously I am on maternity leave at the moment, so please butt in, Neelam or Rachel, if I'm saying something different from what's happening at the moment. There's two kind of levels of triage that happen within the practice. There's the initial triage, which is happening through the reception team. When you phone up for an urgent appointment, you know, you're being asked a set of questions. That set of questions is actually based on a computer-based program that comes through the computer. So, for example, you say you have a cough, then that triage is the questions come up on the computer for the receptionist to ask. So they're not making them up themselves. They're not kind of making a decision, and that comes out with a decision as to where you might want to be pointed to. So, you know, they might point you towards a community pharmacy. It might suggest you need a GP, might suggest the paramedic can deal with it. So that's the first kind of part of the triage. Following on from that, you get to the kind of doctor-based triage or clinician-based triage system. When you've traversed that kind of part of it, then you go on to an elongated list of patients for us to either call, book into an appointment slot, whether that would be face-to-face, and that's based on that information that's been collected by the reception staff. Does that kind of make sense?
Yep.
So the initial triage is being done by non-medical staff, but based on a safe mechanism that has been, you know, trialed in lots of practices to ensure it's not, you know, somebody just making a decision based on a whim. You know, it doesn't cover every symptom in the world, obviously, because, you know, there's lots of people presenting with lots of different things, but a lot of the most common things are kind of covered in that safety net way. So hopefully that answers that.
Yeah, thank you.
It's all right.
Okay, so because I've got no one with their hands up, I'm going to move on to our second point, which was really keen to, we've done a lot of work with the website and in terms of trying to improve the patient information that we share, so that you're not needlessly contacting us when you could have found out the answer in a different way or gone about getting your answer in a different way. So I just wondered if anyone had any feedback or thoughts about how better we could communicate different patient information, knowing I haven't got a magical wand and I can't wave and have an extra few hundred appointments every day at the moment. I'm working on that, but what could we share with patients that you think would really help feel informed and not be so, I mean, one of the examples is probably what Ali's just explained, is it, in terms of how do we triage, how do we assess which patients come through to the appointments we've got at the moment, but has anyone got any feedback on that? Just getting my other screen up so I can document anything you do say. Don't be shy, guys. Is there things you think, how do I get that? How do I want, I don't know, I want a simple blood test, but I don't want to have to wait to speak to a GP. I just need a blood test because I don't know, examples of anything like that. We've all gone into sudden silence. Frankie.
I'll just break the silence to get everyone going. I do think that your aim of expanding the patient triage online, and I absolutely know that not everybody can do it, but I think your example, Lois, of I need a blood test is a really good one, where the patient triage can be useful. We in the patient participation group have had quite a lot of feedback of people who come out of hospital and their consultants have said, you must see a GP within the next week to have X, Y, or Z done, and they just can't get an appointment. And I would hope that those kinds of people could get priority again through the patient triage, that immediately they come out of hospital, if they know that they can go on there and say, I need something for a week, or the reception, and the receptionist can be trained so that when somebody says, my consultant says I have to get this done, that they will actually be prioritized. So I think it's having lots of different routes. Lots of us use the NHS app for our prescriptions, and perhaps having, you know, a day when that can be explained to people in the surgery, just to show you how easy it is. And actually other patients could do that. I'm very happy to pop in and do a little surgery on how to use the NHS app, or how, you know, we can use each other to try to leave you guys to do the clever stuff, and to get that done. I do think your texting has been very good, and actually telling us things. I know there have been a number of slips recently, and I'm hoping we can just overlook those as very bad slips. But I think the more you talk to us, the better, really. But thank you for the opportunity to comment.
Thank you. I'm not being rude. I'm typing and while you're talking, thank you. I'm not looking at a different screen. I'm going to bring, before I come to the next people, bring Rachel Luca in, because you might be able to talk a bit about discharges and actions out of hospital as a pharmacist and how that kind of works. Have I managed to unmute you, Rachel? Or not? No? Has that worked? Yes.
Yep, that's got me. Thanks, Lois. Yeah, so I agree in terms of when we get messages on from discharge letters saying you must have this within 7 days. I agree that there needs to be some sort of priority over that. However, that does rely on the letters getting to the surgery in time, which can sometimes be a delay in itself with the hospital sending out the work. Generally speaking, though, when the letters do get to the practice, the reconciliation, the medicines reconciliation side of things is dealt with the pharmacy team alongside the GPs, and then any follow-up blood tests are also arranged. I also have to sort of put a point out of if the consultant's asking for an appointment for a blood test within 7 days of being discharged from hospital, that can sometimes be a bit of a tight turnaround, given that there is sometimes a bit of a delay in the letters getting there in the first place and capacity. But I absolutely hear you, Frankie. That's a good point that you've raised.
There's something we can definitely look about how we frame that in terms of communication to patients about how they can access us to get those important actions across from when they get discharged from hospital.
Yeah.
Worrying time. Okay, Ray, I should have managed to unmute you, I think.
Yes, thanks again. I've just taken the opportunity to remind myself of using the Judges Close website, to be told that it's temporarily offline and I should phone and quote NF01. So it doesn't always work well. I don't know.
When was that, Ray?
5 minutes ago.
Oh, so the patient triage bit?
Well, I just judgesclosesurgery.co.uk.
Now that's an old website that doesn't exist, well, shouldn't exist anymore. I will follow that up.
Yeah.
Now. Thank you. Because there should be, if it's still up, it should be a redirect to our actual live website. Thank you for that. I will absolutely follow that up. I did not know that. Okay, thank you. And Samantha, I'm going to unmute you, Samantha.
Hi, thanks for sorry, my camera's not working at the moment. So there are a couple of points that I wanted to kind of raise. I mean, unfortunately, my family have used the services regularly because of health issues with my mum, and up until she passed away in November, we had an absolutely excellent service because of her comorbidities, I think, more than anything else. But since she's passed away, I've had to use the services multiple times for my own health issues. And I have found it to be, well, very below par, because I've needed urgent treatment for various different things, and I've not been able to go to the doctors, not to be able to get appointments, and been referred to urgent treatment centre every time. On one occasion for antibiotics, even though my dentist had told me that I needed antibiotics and had called the surgery to advise them.
Oh, Sam, you're breaking up then.
Surgery, even though another professional had advised that I'd got a severe infection, I still had to go and wait 8 hours for.
Oh, you've broken up there, Sam. It's not just me that can't hear Sam, is it? I think it's essentially
to be able to issue antibiotics.
I think I've got the gist of it, Sam. So I think you were saying you were needed urgent antibiotics, and yeah, Ellie's got a hand up. I think she's going to answer that. I think.
Yeah.
I'm sorry that you had a difficult time accessing the practice. The dental issue is a tricky one, which isn't us trying to be awkward. There are rules regarding prescribing for dental conditions for GPs, and we're actually not medico-legally insured to prescribe for dental conditions, which is not us being awkward. The dentist, I'm not passing blame, but the dentists themselves have prescribing rights to their doctors the same as we are, which is the reason why we don't prescribe, because we wouldn't actually be, if something went wrong, we're prescribing for a condition that's been diagnosed by another professional, which isn't us, and we're not able to prescribe in that case, which I can see, you can see that seems that we're being awkward, but that's the reason for it. And we know patients get stuck in the middle, but from a professional point of view, we do have to work within our competencies, and one of them is not dental issues, unfortunately. For example, the dentist wouldn't cheat your chest infection, but you know, I can see that maybe that it may not have been transferred in an appropriate way for you to understand that, but that's
it wasn't.
the reason why, yeah. And you know,
and do they have the rights to? So if they're able to prescribe that, is that still an NHS prescription, or is that considered a private prescription?
And well, if you had an NHS dentist, it would be an NHS prescription.
Okay, that's good to know. Other people might not know that. I wouldn't have known that either.
Yeah. So
okay, thank you. And then the final point I wanted to raise was about the I needed to speak to the doctor about multiple things, and again I was referred to 111. And I said, well, you know, it doesn't need me to go to the hospital, doesn't need me to go to 111. It's just, I just need a regular appointment. And I've been trying for over a week to get a regular appointment with no success. On one occasion last week, well, 2 occasions last week, I was first in the queue, and I still wasn't able to get an appointment for a normal appointment. So the receptionist referred me to the triage online system, which I did not know about. Now I'm technical fine, I'm okay, you know, I can deal with things. I look on the website regularly, but I was not aware of this new triage system where you could put in a request and people would look at it. And so for me, I did that, and it was referred and reviewed within a couple of hours, and I was at the doctor's surgery within 3 hours, which was brilliant. It was not what I expected, but it was much better than I expected. You know, it's a good response, and they dealt with my queries really promptly and referrals to the hospital urgently. So that was really good. However, I feel as though that the communication about these things is not widely known. You know, kind of people don't know about these things, and that perhaps in the surgeries themselves, there's some sort of, you know, session where people can come in and ask questions about where to get information from, and also to put the posters back up in the doctor's surgery and information about where to get help about certain things on the website, because there's nothing. So somebody who goes in there, the receptionist is so busy that they can't remember to tell everybody everything, and to give people self-help, the ability to find these things themselves and know where to go by looking at things in the surgery, I think would be much more helpful.
That's really helpful, Sam. I'm pleased you've had a positive impact, and that's something we definitely want to grow that service as our capacity grows, because we know for lots of people it will be really beneficial. I've written down about advertising the waiting room, because that's a really good point, and how we get that better, because what we want to do is make sure it's current and doesn't become boring and people start reading it. So really good point. We can now, COVID is officially over apparently, guys. we can definitely look at improving that, and that's something, is a really good point. Thank you so much for your points today.
Thank you.
Okay, I am conscious of time, so the last thing I wanted to talk about, and I'm going to hand over to Bill wherever he is, he's hiding behind the screen, to talk about future different engagement methods. Are you there, Bill? You're hiding behind your camera.
I've just been answering the chat questions. There's been quite a lot. Thanks, everyone. A lot of good questions there. Yeah, so just thinking about how we can do this in the future. Someone did mention why are you only doing this online, and we do have some in-person events next week, but then someone did point out that maybe they had to register online for the in-person events. So Lois, it was just a question there.
I think the communications have said, I'm sorry if we haven't got that right, that people can speak to in-practice or contact the practice. I know, don't want to hang on the phone, I know, but the guys can register on their behalf.
Yeah, because there's a mixture of ways of doing engagement, and I personally think Zoom's, you know, this sort of Zoom type environment's really good, because there's obviously conversations going on in the screen between 1 or 2 people that everyone can listen to, but at the same time we have the chat function going, which gives everyone a chance to contribute. So I always think it's a really good way to get people's views, the people who might not always be the first people to speak up. So you get a real range of views and questions when you can use this type of format, which I think is quite useful. And it's also a bit more convenient as well. I know I chatted to someone earlier who said, well, you know, they wouldn't be able to do this in person at the surgery, but because it's online, they can join and be part of the conversation. So I think, you know, for me, this is a good format if you're digitally enabled, which not everybody is, obviously. And next week, we will have some in-person events. Now, in many ways, what we're doing, we're kind of doing patient-involved, patient-informed type consultation. So we've got patients involved and we're informing patients. You know, Lois has been talking about what happened in June, what's happened in July. We've presented some figures, which is all really, really useful. But it'd be really nice to get to a position where maybe the patients weren't just involved or informed, but they're leading as well. And I think there's 1 or 2 members of the patient participation group on here who are maybe trying to take a bit more of a lead in some of the challenges here. You know, one of the challenges raised a lot is the communication. And I think in the world we live today, there's so many different ways to communicate. So it is a bit tricky communication because there's social media. We still have the traditional formats, you know, posters and leaflets. So many people have different media they take in. You know, people don't read as many newspapers these days. We pick up so much information from our phones and devices as well, but it's from such a range of media providers. It's really difficult to communicate in this day and age. And I'm sure, like Maggie, who joined us earlier, and she made a mistake joining us, she kind of got that from maybe word of mouth from someone, which as we know, you know, if somebody tells you something really good. Anyway, so lots of different ways to do engagement. So if anyone has any preferences, please put them in the chat. I think, you know, a mixture of online and in person is good. I'm really keen on hearing from patients we don't always hear from. So some of the engagement we've done in other parts of the country involves patient cohorts, people with certain conditions. It might be learning disabilities or mental illness. And then you get a richness of views, not just from patients who can participate in these types of format, but we can actively go out and get patient cohorts who maybe use a lot of GP services, but we don't often hear from when we do engagement. So I'm always quite keen to see if there's ways of targeting patients who use services who don't always take part in these events as well. Again, if anybody's got any comments on that or any particular conditions or cohorts that they might be interested in or making sure that we try and speak to, please again put that in the chat as well. And then if we've got active patients and we're a bit involved and we're getting informed, the next step, again, some of the things we've done in other parts of the country is we look at co-production and co-design of services. So we kind of look at some of the challenges. And in many ways, some of you are already doing this with Lois, where we're taking these challenges and we're starting to reshape the service according to the involvement and the comments that people are making. And people have made a lot of comments tonight. I think from what Lois has shown us already, there's progress being made in some areas. There's still stuff to do in other areas. So that's quite good as well. But as long as, hopefully, we have the confidence of the patients that there is a plan and we know where we're trying to get to, the journey will never be easy when we make these when we make these commitments to head off on that journey. But I think, you know, to have the patients involved and informed and leading where possible, but also getting involved in solving the challenges is really important. So hopefully there's some comments in the chat. Obviously, I'm not looking at that now, and we've got some idea of where we'd like to go. But, you know, a mixture of online and in person is quite good. Getting the voice of patients who we don't always hear from, but use services, I think is really important as well. And just, you know, trying to get people not just informed, but involved and maybe more involved, if possible, is really good. So I hope that makes sense to everyone. Lois, anything you want to pick up on from there?
Yeah, I think just leading on from that, I think we'd like to be quite ambitious with our wider workforce in terms of reaching out to those harder reach patients to do like learning disabilities or other kind of long-term conditions. and we're running some events sort of out in the community, especially around the flu vaccination time with other community groups, to try and provide that support. And then in doing that, getting out there in the community and talking about the services and how you access. And I think Sam's point earlier was really good about what can be run out of our patient waiting rooms. Obviously, we've got new extensions at Ship Street and Judges that we are just expanding into, and how can we utilise those to do some, you know, really meaningful sessions with patients, whether it's on about the services we provide and how it could work better from a patient journey point of view, what our website is like, and really target you know, working with different smaller groups to then come together in a bigger forum, say in October when we meet again, and say we've met and these are the things we'd like as patients are our absolute priority. And obviously getting an appointment is a priority, and hopefully as we move on through the month that capacity will increase, but there's other things that contribute to that, and we're really committed to try and working with the community. And I'm conscious that Jill Gallagher's had her hand up for a long time, and I'm very sorry because I've only just seen you in the list. I'm going to unmute you now. You should get a message to unmute. Have you got a message?
Hello, it's Kevin Gallagher actually. Can you hear me?
Oh, hi. Yes, I can hear you. Yes.
Yeah. Regarding this meeting, I don't think it's a very good format at all. I'm chairman of the Crawley Down Health Action Group, and we did actually ask Modality to a public meeting where there'd be proper question and answer session where people who don't have online access would be able to attend, and Modality refused to actually consider that.
So I think we are doing 3 patient engagement face-to-face next week. So that is an open.
Yeah, but you have to be online in order to actually register to go to those.
So you can register online, but you can actually register the practice, and we've had a really good uptake on that. I mean, the best will in the world, we couldn't have 10,000 people.
No, but we would have hosted a meeting where you didn't have to go online, and that was declined.
Say that again, sorry, I couldn't.
We would have hosted a meeting where you don't have to go online, but Modality declined that.
Okay, I would have to follow that up because I'm not sure of the detail, and I would have to come back to you on that. I think I've got your contact.
Yeah. And I have asked numerous questions this evening, which simply haven't been answered at all in the chat.
Okay, I've not been much to chat, but we can definitely follow that up afterwards. And if there's anything outstanding in the chat, we will come back to you.
No, I mean, for example, we don't ever get a figure on how many doctors there are in Crawley Down.
Okay, that's something we can take away and come back to you with an answer.
And we've never had a satisfactory answer on the ownership of Modality, and the fact that the owner of Modality also owns 14 other companies involved in private healthcare and private health insurance, and the obvious conflict of interest that poses.
I didn't hear everything you said, but I think it was saying about the ownership of Modality. Is that?
Yeah, it's owned by Dr. Kumar, who owns 14 other companies involved in private healthcare and private health insurance, and there's an obvious conflict of interest.
Okay, I've got a document that is going on our, we're going to put that information on our website about the ownership of Modality as a GP partnership and how that works. So I can
sent that document, and I have been sent that document, and it's not at all convincing.
It's not what, sorry?
Not at all convincing.
Okay. We can come back to you separately on it, and definitely follow up those questions if that would help.
Also, with regards to patient numbers, Vincent Sy said a couple of months ago that patient numbers in Mid Sussex are falling, which is in complete contradiction to what's been discussed this evening. And it all seems very odd that the CEO seems to think that he's got an area where patient numbers are falling, where this evening people are talking about them increasing.
Again, I have to take that away because I wasn't party to them making that comment, so I can go back to him and find out.
He made it at the meeting of East Grinstead Town Council, a public meeting, East Grinstead a couple of months ago.
Okay, I can follow that up for you. Frankie, do you want to come in?
Yes, please. I'd like to change subject and get back to how we improve care for patients, if that's okay. Sorry, I don't know I'm going to call you Jill because I didn't catch your name. Sorry to interrupt you. I was just really interested in how we communicate, again, the question you're asking, and also Rachel has written on the chat about using the NHS app for one thing and the patient access app for another. and I consider myself to be quite, savvy about these things, and that confused me a little, Rachel. So why can't we use the NHS app for ordering, not ordering the one-off that isn't on repeat? There is a function on there, but it's not there. Why do we have to have different apps to do the same thing? I'm sorry to interrupt. I just thought I'd get us back.
I completely agree, Frankie. The NHS app is an external app that's not run by the surgery, so we don't have the ability, my understanding anyway, is that we can't or use it for that function. So it's not something, when I try to use the NHS app for my own surgery, I can't free type to request things. So I agree, it's not an ideal. It'd be great if you could do that on the NHS app, but we don't have any control over that, unfortunately. So yeah.
Oh, Frankie, yeah.
Thank you. There is a facility on the NHS app, and other surgeries have that facility working. But for our surgeries, when you try and type in, it says the surgery is not allowing you to use this function.
Right.
So I've talked to Lois before about this, so I won't talk it, but I just wanted to get it back on there.
Thank you for that, Frankie. I'm happy to have a look at that again, certainly. And Lois,
Lois has the screenshots.
Yeah,
Yes.
great, fab.
I'll share them with you, Rachel.
Thank you.
Okay, thank you. Okay, are there any other questions on the patient engagement or ideas of how we can engage in the future with patients? I'm happy to do, is it Kevin, I think. I hope I heard it right. I'm really sorry if I called you the wrong name.
Yes, at the moment, you're directing all these conversations towards Modality Mid Sussex. The problem is we feel we're being very badly treated in Crawley Down. We want the meeting in Crawley Down with Modality.
So I think I caught that. I think it said you talk about Modality Mid Sussex, but you want to specifically talk about Crawley Down.
It used to work. We used to have a perfectly good doctor's surgery in Crawley Down, and now it's begun to Modality. It's rubbish, and that is the issue.
So we are coming to Crawley Down next week, on Tuesday next week.
Yes, and as discussed, we did offer to actually host a proper meeting where everybody would have access to that.
Yeah, I challenge you to let every Crawley Down patient to have access to one meeting, but
No, not everybody, all those who would be interested.
Yeah, so well, we've got a lot of people. We're sold out the Crawley Down one, and
and you would have got a whole load more as well. But
so what I'd like to say to you, let's see how the meeting goes next week on Tuesday at Crawley Down. And then any further on interaction and engagement we can have, we can.
Can I ask who's going to be attending that meeting?
Sorry,
who's going to be attending that meeting for Modality?
So there's some representatives from the practice, there's representatives from ICB, myself, Bill.
So what is your role? Because I missed the start of the meeting. What is your role in Modality?
I didn't catch that. Can you say it again?
What is your role in Modality?
So I work with the Modality Partnership nationally. I've got a background in managing lots of practices elsewhere, but I've been working with Mid Sussex for the past couple of months on their improvement plan and supporting their team.
Why are not Vincent Sy and Dr. Kumar going to be there?
So I'm not sure about Vincent. I think we decided it was a local thing that, but there are different partners who are going to be represented at different patient engagement events just because of availability and who's providing clinical care during the day and can get there. So that's what's happening. Okay, hope that answers your question. Is there any other questions about a future engagement, or is that everyone happy with that? If there's no other questions for this evening, I will close slightly early, give you 10 minutes back of your evening. Just to say, obviously, we recorded this session and we've got the information from the chat. I've typed on slides to try and capture as much as what you said. So thank you so much for your time. And I'm going to take one more question. Is it from Jeffrey? I've asked to unmute Jeffrey.
Sorry, it's Shirley again.
Sorry, Shirley. Forgot.
Could I just get some clarity? I was offered some support, well-being support from the surgery, and decided that I should go for it. You know, it's a positive thing, so I should go for it. And it turned out to be an app from a company an independent company called QUI or something like this, which wanted me to put all my details in. I'm 71 years old. I'm not bad technically, but I don't use apps that much. And it struck me as actually being quite concerning. It's based in India, but this was recommended by my surgery, and I just didn't feel secure using it. It certainly wasn't warm and comforting and cuddly to use, so I just stepped back on using it. I'm sure it is good, and you know, it's a positive thing, but can somebody sort of clarify what the hell it is for me, please?
So I think I know what you're talking about. I think you're talking about the online health coaches, which is an initiative we piloted in other parts of the country. And essentially patients can be referred into that service if they want to use an online health coach, and provides other different things. I am not an expert in it, so I'm hoping that one of the other Rachel's going to put a hand up for me. Thank you, Rachel. There you go. You got that?
Thank you.
Hi. Yes, I hope I can give some clarity. At the moment, there's sort of a well-being team available in the surgery, in the East Grinstead surgery. It's not currently available to the Parkview surgeries. However, they have some limited capacity in terms of what they offer as appointments, telephone appointments, more of a kind of one-to-one, I should call it kind of cuddly, I suppose, or just sort of a bit more reassuring. But they offer them over a 6-week course. However, with the number of appointments they can offer, it's not always widely available. So this Joki is the app, I think it's called GOQII, I think is what it is.
That's it, yeah.
And that's another one that some people find easy to use because they prefer the kind of app interaction. It fits in with perhaps a busier lifestyle, but I completely agree it's not for everybody. So the idea is that by offering it's just another route essentially to offer out. In terms of security, and I understand where you're coming from, sharing your data, it is all secure and that is shared just with the surgery and the company that we use to outsource this, so to speak, if that helps.
It seemed to be suggesting that I could get points by good behaviour health-wise.
Okay.
And we'll follow
then
that up, Sheila.
and then I could get products, and it just all didn't seem right.
Okay.
It seemed to be very aligned to a sort of the Vitality insurance system, but you know, I don't want insurance.
I will take that feedback and follow that up and try and get some more further information and work out exactly what's being offered and how it works. And
yeah,
because actually you're right, if you've been referred into it, if you had a full information about what it was about, either you'd say that's not for me, or you might have said, oh, I get it now, that's fine. So yeah, we will definitely follow that up and provide some information on that. Thank you.
So actually, instead of helping my well-being, it
did the opposite.
It did the opposite. Yeah.
Oh no, I'm sorry about that.
Okay.
Yeah, thank you for your input. Okay, I'm going to take one more question, then we will finish for the evening. So is it Carol? Carol, I think I've messaged you.
Thank you. It's just an additional point about that service that I used it and decided it wasn't for me. The biggest issue I found with it was that they had no knowledge of my medical situation, and at the moment I'm waiting for a hip replacement and how many miles I walk today and various other things, and it just became the level of articulacy as enormously frustrating. My real medical history, so it wasn't for me. But I think it needs to be careful who is referred to it.
Yeah, that's a good
people point. Are in a situation where they feel they should really do what it says.
That's really helpful. I think I caught all of that. So I think it's saying you didn't have medical knowledge of a situation, really it could be good for some people, but we're careful who refer to it because it may not be appropriate. Obviously asking how many miles you bought when you're waiting for hip replacement isn't very helpful. Yeah, so thanks for that. That's really helpful. Thank you, Carol. Right, I think we've gone through all the questions for this evening, so I'm going to close and say thank you so much for giving up your Monday evening to spend some time supporting us and listening to us, and you've all been brilliant and so respectful, so I really appreciate all of your time. I was saying before, this is recorded, we can download the chat. I've captured as much information I can, so we will be capturing information at every one of our 5 patient engagement events in July, and then we'll be feeding back into patients in August about that and further updates of what's going on, and hopefully some really positive news going forward about increasing capacity and recruitment. We're doing, at the moment, in the next couple of days, we're refreshing all of our job adverts that'll be going out again across social media and our website, and across in the coming days we'll be putting all of those out there. So I'd really appreciate if you can share them on social media or anywhere in the world. We'd love that to be shared. If you can support us with that, would be absolutely fantastic. So thank you very much for your time. Enjoy your evenings, and thank you again. See you later. Bye.